Good afternoon everyone, my name is Richard, I'm a dentist from Newcastle University. I work in the dental hospital there as well. Currently doing a PhD around e-cigarettes and periodontal health, so the gum diseases that we see. So hopefully I can shed a bit of light on where we are at the minute in this kind of field. Disclosures of interest, I don't have any. I'm funded by, my salary is paid by NIHR, that's my only disclosure. So, why is this interesting? So, probably all aware that tobacco is not the best thing for oral health. The two main things there's lots of detrimental side effects, but the two main things are oral cancer. And we know that someone who's a heavy smoker and a heavy drinker, so that's classed as over 2 drinks a day and 20 cigarettes a day, has a 38 times increased risk of developing oral cancer, so that's a significant burden. But my main interest is the gum diseases, periodontal diseases, the severe end of gum diseases. And these days that extends to implants. There's a lot more dental implants around, and you get the same problems, probably more so around dental implants. And that's been said to be the 6th most prevalent condition in the world, severe periodontitis. And smoking is the biggest risk factor. Diabetes is also quite a big risk factor as well. So that's the problem. And kind of feeding on from what Jack was saying, in tobacco, nicotine probably isn't the bad guy, which leads into my next slide. So nicotine, we know, doesn't cause cancer, it's not carcinogenic, and there's been really a whole load of experiments on this over the years, looking at the effects of nicotine on oral health. Very little clinical studies, if any, a huge number of lab-based studies, so studies where people have a petri dish of cells and expose them to, liquid nicotine or vapor nicotine or whatever, and it seems to have been a bit of a favourite postgraduate project over the last couple of decades. And there's a whole range of effects, and it's all about the interpretation of the effects. And you can show negative effects on cells, and there are negative effects on, for example, fibroblast attachment. So that's the gum cells and how they attach to the tooth surface. And you can show that if you expose them to nicotine, they don't attach so well. But it's trying to put that into a clinical context is quite difficult, actually. So there's a lot of this evidence out there about nicotine, but nicotine probably isn't the bad guy. It's probably all the other stuff. What about vaping? So do we have any evidence about vaping? It's quite new, and research takes a long time to catch up. There's some models. Again, there's some laboratory-based models showing damage to DNA, showing cells are dying, showing functional effects of the cells are deteriorating. But a lot of these studies have questionable methodology, and again, interpretation can be very different depending on your point of view. What about some clinical studies? So we have a little bit more here. I've listed 4 here. They're all very early stage pilot studies, all with small numbers. So you see most of these are in the 20 region. None of them have a randomised design. So, very small scale clinical projects so far, but they all show a positive effect when someone stops smoking and switches to vaping, whatever they're looking at. So some look at kind of toxicity of the cheek cells, some look at periodontal, some gum outcomes, so how much the gums are bleeding. They all see a positive effect over time, which is encouraging. We can't base too much on that because they're just pilot studies, but it's kind of suggesting the direction of movement, I guess. So what am I doing? So to plug my research, so I am doing another pilot or feasibility study, but it's larger than the rest. So we're looking at 80 participants, and we're doing a randomised design. So it's the most robust type of research you can get. It's a randomised controlled trial. All our patients have gum disease, the more severe end of gum diseases, and they all get the same dental treatment. What we're kind of changing in the study, our intervention, is different types of smoking cessation support. So everyone in the study gets a brief intervention by the dentist and referral onto the stop smoking service if they choose to. And half our participants in the intervention group get an e-cigarette starter kit, a little tutorial on how to use it, and then they go away and see how they go on. So yeah, that's where we're at. We've recruited 76 of the 80 participants, so we're almost there. So hopefully in a year or 18 months we'll be able to start presenting some results. And we're looking at everything here. We're looking at the bacteria in the mouth, we're looking at how the gums are, we're looking at the inflammatory response, so how angry the gums are. We're looking at smoking outcomes, obviously. Do people smoke less or more or quit more often? And also some behavioural aspects to it. So how what do people think about this? What did our participants think about being provided this by a healthcare professional? So lots of outputs, hopefully. Slightly different angle now. What do dental professionals think about vaping. So this is a question that's been asked by ASH quite a lot. So they do an annual survey by YouGov, and they ask this question every year. So I've put up here the data from 2013 to 2017, so the last 5 years. And the first thing is to look at this blue bar here. So this blue bar's got bigger year on year, and now it's a quarter basically of people in the survey think that e-cigarettes are more or equally harmful to health, which is obviously, most people would disagree with that. Most people working in this field, public health people, would probably think the right answer is the yellow box, which is e-cigarettes are a lot less harmful. Even probably the most critical people would probably say it's the blue one, so less harmful. But the public perception seems to be going the opposite way to maybe the evidence. So I wanted to see what's happening to dental professionals. So we did a survey of 200 dental professionals in the Northeast earlier this year. And you'll see there's a slightly higher percentage thinking it's more equally harmful, so it's now about a third. There's less people on the fence, so the don't know category was quite small. And there was quite a large number of people thinking less or a lot less, so that's encouraging. But it was quite worrying that almost a third felt that the e-cigarettes are more equally harmful. I must kind of qualify that in that was all dental professionals, so that was dentists, hygienists and nurses. And when you dig into the demographics, it was actually dental nurses that ranked it really, really highly. So almost half of dental nurses answered to that category, whereas dentists and hygienists were about 15%, so lower than the population. So there's some interesting dynamics going on there, I guess. So why is this happening? So dental professionals and healthcare professionals more broadly aren't immune to the same influences as the general population, so the media stories. And also, as a healthcare professional, you maybe are slightly more cautious. You maybe take a more cautious view if you're recommending something or having that discussion with someone. There are some interesting news stories, though. I've put a few on here. In the dental press. So, for example, there was this top one. There was a tweet by University of Rochester saying that their study showed that vaping was just as damaging as smoking to gum health. And this, got a lot of attention, and there's lots of dental kind of Facebook groups, for example, that people share cases on and discuss, and this was circulated, and people probably looked at the headline and didn't look at the study. And this was really heavily critiqued, this actual study. I critiqued it. Several other commentators in the field, so Clive Bates, some of you will have heard, commentated on it, and the UK E-Cigarette Research Forum, UK E-Cigarettes Research Forum, Cancer Research UK based, also critiqued it. And one of the main things was they didn't even have tobacco cigarettes as a control in this, so they didn't even compare it to smoke. So the headline doesn't really work at all if you haven't got that as a comparator. And this goes through loads of different articles, and one just last month in the British Dental Journal. So this goes to pretty much all the dentists in the UK who are registered with the British Dental Association, which is most. And it started off in the introduction saying that vaping, this smoke-free legislation in the UK had been extended to cover e-cigarettes, which is totally false. That hasn't happened. There's voluntary, obviously, restrictions in place. But this was in the first paragraph, and these sort of errors were throughout the article, and this just kind of shows you the misperceptions that are out there. There were some good comments. So there was one comment saying, if a smoker comes in to me, this was a kind of an interview with a dentist, and they said, if a smoker comes in and they're using an e-cigarette to stop, I want to be very positive and I'll encourage that. So there's mixed views out there, I think, to be fair. So tobacco is really detrimental to oral health, we know that. Nicotine probably has been unfairly blamed. We need more research to really hone in on this, and to look at what impact, if any, nicotine has, but we need to do some further research on that. Vaping, we obviously have some pilot studies that are encouraging, but we need further definitive, appropriately designed with appropriate statistics for healthcare professionals to base their conclusions on. And dental professionals' views are really mixed at the minute, and I think that's not just in dental professional fields. I think that's much more broadly amongst healthcare professionals and probably public health people a little bit as well. So that's my wee summary of where we're at with dentistry and probably healthcare professionals and nicotine and vaping. And I look forward to the discussion later.